Do your legs go numb at night? If you're over 60, that sensation you've been brushing off as just poor circulation or sleeping in a bad position may be something your doctor needs to know about right now. Because certain patterns of leg numbness, tingling, and weakness in older adults are among the earliest warning signs of stroke, and most people don't find out until it's too late. Today I'm going to walk you through the specific symptoms that deserve immediate attention, why they're so easy to miss after 60, and what you need to do the moment you notice them. Stay with me, because the difference between catching this early and missing it can literally be the difference between full recovery and permanent disability. Welcome back. On this channel, we focus entirely on health after 60, because the warning signs your body sends at this stage of life are different from what they were at 40. They're subtler, they come and go, and they're far too easy to explain away. Stroke is the 5th leading cause of death in the United States and a leading cause of long-term disability. What most people don't know is that the brain often sends warning signals days or even weeks before major stroke occurs. The problem is that these signals are frequently ignored, sometimes by patients and sometimes even by doctors, because they disappear on their own and feel minor in the moment. After 60, understanding what your body is trying to tell you isn't optional. It could save your life. So let's get into it. Warning sign number 1. Numbness or tingling in one leg, especially on just one side. The key word here is one side. Occasional tingling in both legs after sitting in an uncomfortable position is almost always harmless. But when the numbness or tingling consistently affects only one leg, one foot, or one side of your lower body, that's a neurological pattern, not a circulation issue. The brain controls sensation in a highly organized way. When a blood vessel supplying one hemisphere of the brain becomes partially blocked, the disruption in sensation shows up on the opposite side of the body. So, numbness in your left leg may actually point to a problem on the right side of your brain. This kind of one-sided sensory change is one of the hallmark early signs of a transient ischemic attack, what doctors call a TIA, or a mini-stroke. A TIA produces the same symptoms as a full stroke, but they resolve within minutes to hours. The danger is that a TIA is often a direct preview of a larger stroke. Studies show that up to 10% of people who have a TIA will have a full stroke within 90 days, with the highest risk in the first 48 hours. If you notice one-sided leg numbness that comes on suddenly and can't be explained by position or pressure, do not wait. This is a same-day medical evaluation, not tomorrow, not after the weekend. Warning sign number 2. Weakness in the legs that comes on suddenly without exertion. There's a difference between muscle fatigue after a long walk and sudden leg weakness that appears out of nowhere. Stroke-related leg weakness tends to come on abruptly within seconds or minutes and affects one side of the body. You might notice that one leg feels heavier than usual, that your foot is dragging slightly when you walk, or that you're losing your balance in a way that feels neurological rather than physical. After 60, it's common to attribute new weakness to aging, arthritis, or fatigue, and often that's exactly what it is. But sudden asymmetric leg weakness, particularly when combined with any other symptom on this list, is a red flag that warning immediate evaluation. One important distinction. Stroke-related weakness is usually not painful. It feels like the connection between your brain and your leg has been interrupted. Many people describe it as their leg not responding the way it should. If that description sounds familiar, pay attention to when it happens, how long it lasts, and whether it affects one side more than the other. Warning sign number 3. A sudden, severe headache with no clear cause. Most headaches have an obvious trigger: stress, dehydration, eye strain. But a headache that arrives suddenly and at full intensity with no warning and no apparent cause is medically described as a thunderclap headache, and it's one of the most serious warning signs in neurology. This type of headache can indicate a hemorrhagic stroke, bleeding in or around the brain. Unlike ischemic stroke, which is caused by a blockage, hemorrhagic stroke is caused by a ruptured blood vessel. After 60, the risk of both types increases significantly, particularly in people with uncontrolled high blood pressure. The headache itself may be accompanied by neck stiffness, sensitivity to light, nausea, or a brief loss of consciousness. Any one of these combinations, especially in someone with a history of high blood pressure, is a 911 call, not a call to your doctor's office, not a wait-and-see situation. Warning sign number 4. Sudden vision changes, blurring, double vision, or loss of vision in one eye. Your vision is directly processed by specific regions of your brain. When blood flow to those regions is disrupted, the result shows up immediately in what you see or can't see. Stroke-related vision changes tend to be sudden, affect one eye or one visual field, and may last only a few minutes before resolving. A temporary loss of vision in one eye, sometimes described as a curtain or shade coming down, is called amaurosis fugax, and it's a recognized warning sign of an impending stroke caused by a blockage in the carotid artery. After 60, vision changes are common and often benign: cataracts, dry eyes, floaters. But there's a clear difference between gradual bilateral changes and sudden, one-sided vision loss. If your vision changes abruptly and then returns to normal, that resolution does not mean the danger has passed. It may mean the clock has started. Warning sign number 5. Difficulty with words, speaking, finding them, or understanding them. This one is particularly important because it's one of the most overlooked symptoms in older adults. Stroke-related language difficulty can show up in several ways. Slurred speech, the inability to find a specific word you know perfectly well, saying the wrong word without realizing it, or suddenly having trouble understanding what someone is saying to you. These disruptions happen because the language centers of the brain located primarily in the left hemisphere are being deprived of blood flow. What makes this symptom tricky is that it can be subtle. A brief moment of confusion, a word that won't come, a sentence that doesn't quite come out right. After 60, it's tempting to attribute these moments to tiredness or age. But when they happen suddenly, pass quickly, and combine with any other symptom on this list, they deserve immediate attention. The BE-FAST acronym is worth knowing: balance, eyes, face drooping, arm weakness, speech difficulty, time to call 911. If you or someone near you shows any combination of these signs, act immediately. Before we close, here are 4 things you can do right now that meaningfully reduce your stroke risk after 60. First, know your blood pressure numbers. Uncontrolled hypertension is the single biggest modifiable risk factor for stroke. If you take blood pressure medication, take it consistently. If you haven't checked your numbers recently, check them this week. Second, know the difference between a TIA and feeling off. A transient ischemic attack is a medical emergency even when symptoms resolve. If you've ever had an episode that sounds like what we described today and dismissed it, bring it up with your doctor at your next visit. Don't assume it was nothing. Third,
Atrial fibrillation significantly increases stroke risk up to 5 times higher than average. If you've been told you have an irregular heartbeat, or if you feel palpitations regularly, make sure your doctor has evaluated your stroke risk specifically.
Fourth, aspirin is not universally recommended for stroke prevention after 60 anymore. Guidelines have changed. If you've been taking a daily aspirin on your own initiative, talk to your doctor about whether it's still appropriate for your specific situation. Which of these warning signs surprised you the most? Leave a comment below. I read every single one, and your question might be exactly what someone else watching this video needs to hear. If this was useful, share it with someone over 60 in your life. A parent, a sibling, a neighbor. Recognizing these signs early is one of the most important things you can do for the people you care about. And if you're not subscribed yet, new videos every week focused entirely on health after 60. No ads, no products to sell. I'll see you in the next one.